Hello everyone, I am Professor L. Sreenivasamurthy from Life Care Hospital and Research Center, Bangalore. Today the topic of discussion is management of hypertension. What is normal blood pressure? The risk factors for blood pressure. How can we modify in our daily routine lifestyle the risk factors and management ultimately. So everybody has got doubts about what is a normal blood pressure and how does it produced. Every time the heart pumps, it produces the blood or pushes the blood away from the heart into the circulation. That's called a systolic blood pressure. At the same time, the heart has to relax, and that's called diastolic blood pressure. Even then, the blood is pumped out. And this is measured or told in normally in writing 120/80. The systolic is the upper one and the 80 is the lower one. So basically each time when each beat, the blood pressure is produced, or the pulse rate what we check in the hands, that is what it is. So normally in a healthy person, there is a fluctuation in the blood pressure, and it can definitely vary based on your stress, based on your sleep, based on your exercise, the amount of salt you have taken on a given day. It depends on these factors. So whenever the blood pressure increases beyond a level, we call it 140/90, or recent guidelines which is released just yesterday by ADA 2023, the diabetes guidelines, which says 130/80 is to be considered as hypertension in a diabetic background. So anything above these numbers, we call it as a hypertension or a high BP, what common people talk about. And there are various risk factors. The commonest is age. Age related, the risk factors will increase, and as you grow older, you tend to develop hypertension because the elasticity of the blood vessels comes down. Next is of course the family history, where a strong family history in your parents, in your brothers, sisters, etc., you will be more prone to develop the hypertension. And of course excess salt intake. By default, Indians, we consume more salt in the form of extra salt, which is your peppered, pickle, etc. And this is something which is the major culprit, because normally the sodium intake is supposed to be about 2300 milligrams, and we consume double this amount in an average Indian diet. And that's something worrisome, and that's one of the easiest methods to bring down or keep your BP under good control. Of course, another problem with the growing young children is the processed food. The artificial food, what we store in a refrigerated and then boil it and cook it and then eat it, the processed food contain a lot of salt. So it's a good habit to learn whenever you're buying something, the processed foods, to look at the label indication for the sodium content, and that's how you should purchase. And of course, the most another common point in most of the youngsters, especially the IT industries, is the stress. And of course, any profession now, lot of stress, especially post-COVID, all of us undergoing with various stress in the form of physical, mental, economical stresses, all this, and that's something, another culprit, which is there seen as a commonest risk factor for development of hypertension. Now, hypertension or high BP is called a silent killer. Why do we say so? Because most of the cases, most of the patients do not produce symptoms, and that's why it's called a silent killer. That is why it is more dangerous, because none of the patients come to us voluntarily looking for hypertension. So it's very important, when you know you are at a high risk category, you need to go to doctor at least once a year above the age of 40 years to get it measured. It's very easy to diagnose because of the instrument called sphygmomanometer, or the BP apparatus, what you call. And now we have a digitalization in that. There is the mercury, which you used to see a column, they are all banned by WHO long back, and now only the digital BP apparatus are recommended, which all of you can possess, and that will be a very good tool for controlling your BP once you are diagnosed with BP, not to measure your BP when you do not have BP. So once a year you need to visit doctors, at least after the age of 35 years if you have high risk factors, at least 40 years if you do not have any risk factors. Once a year, please go to a doctor and get your sugars, BP, and some basic tests examined. So the only way I would say to diagnose BP would be to measure your BP through the BP apparatus. And it's usually measured in this instrument, as I said, and the upper number, as I told you earlier, indicates the systolic blood pressure, where the blood is pumped out of the blood, and the diastolic, when the heart muscle is relaxing. These are the two ways where you have your BP measured or represented when we write as 120/80. So as I said, 140/90 is for sure, it's a hypertension. There is staging 1, 2, 3, etc. there is pre-hypertension, all that, you need not get confused. But anybody above 140/90 on 2 or 3 different occasions has to be treated or diagnosed as hypertension. And of course, whenever we diagnose somebody with hypertension, we always look for their risk factors which are modifiable. Now, there are 2 categories of risk factors. One is modifiable, non-modifiable. Non-modifiable will be your family history, which you cannot modify. But most of the other things are modifiable. Smoking, lack of exercise, obesity, and of course, the stress. These are the modifiable risk factors which we tend to diagnose in a given patient and advise them to modify these factors in their lifestyle. And now let's look at how successfully can you control your hypertension or high blood pressure through these risk factor modifications. The first thing I would advise is regular exercise or physical activity. This is something most of the patients do not do, and they start developing this habit only when they're diagnosed with hypertension or a diabetes or a heart disease. Please do 30 minutes of physical activity per day, which can keep away a lot of these diseases in future. And unfortunately, many of us do not do this regular physical activity, claiming all of us are busy. Exactly, all of us are busy. In that busy schedule, you need to figure out 20 to 30 minutes per day in your busy lifestyle to protect your health in future. That's called primary prevention. And if you do not do this, you will end up being hypertensive. Then it's called secondary prevention. That means after a disease, this is the lifestyle modification which a doctor has advised you apart from the medications. So you decide you want a primary prevention or a secondary prevention. Of course, we are all aware that the age and gaining weight are the easiest factors which can result somebody into hypertension. So that's something you need to. So how do you prevent aging? You cannot. So follow the physical activity regular basis which tries to maintain your weight. The age keeps advancing, but the weight can be managed with a stipulated timings for your exercise on a daily basis. That's very, very important, because most of us don't try to do this in the weekends when you're partying or when you're going out, when you're traveling. Please find out at least 20-30 minutes of time for yourself, so that with advancing age, with advancing risk factors, you can still manage the better control of your BP. The next modifiable risk factor which you can adapt in your lifestyle apart from exercise would be healthy diet. It's a very complicated, whenever we say a good diet or a decent diet, or low salt diet, patients get confused. Now, what does healthy diet means? Obviously, what our ancestors used to do is to consume a lot of vegetables, a lot of fruits, and that itself will modify or rectify a lot of basic defects in the etiology of hypertension. So there are various diets prescribed, something called as a DASH diet or a Mediterranean diet, and eating less saturated fats, which again most of us tend to do with this junk food and the westernization, the culture, what we are trying to follow or what our children are trying to adapt. You need to put a break for that so that this does not continue. And of course, getting plenty of potassium through fruits again, and limiting the amount of sodium. Again, as I said, in Indian diet, we almost always consume double the dose of recommended salt in our regular diet. And the DASH diet stands for dietary approaches to stop hypertension. Dietary approaches to stop hypertension is called DASH, DASH diet. And this basically consumes whole grains, fruits, vegetables. Nothing new in that, but there are trials done with this DASH diet, Mediterranean diet, where up to the tune of 11 millimeters of mercury that the BP has come down with purely DASH diet without any tablets. And that's something all of you should remember. A DASH diet can result in a better control of hypertension apart from medications if at all you require. So please follow these diets which are prescribed, are told, enlightened by your doctors or dietitians, and that will give additional benefit so that your requirement of tablets might come down. And that's something all of you should remember, that the requirement of tablets to be minimal as far as possible, because we also as doctors do not like to prescribe the more number of tablets. And of course, as I said, reducing the sodium in your salt. As I said, read the food labels, and of course the eating lesser sodium in our regular culture. It's a part of our culture, eating papad, pickle, etc. But you should try to minimize these in our regular daily intake. Taking these meals, full meals, what we call in a marriage party or in a festival day, is something different. But on a daily basis, please try to avoid this extra salt in these sides dishes what we tend to eat typically in most, whether it's North India, South India, it's all same. We tend to eat this excess salt, and that's what is the major culprit why in our country a lot of hypertensives are there. And of course, another modifiable, easily a doable thing is to quit smoking or quit tobacco in any form. I would say not only smoking, tobacco chewing is one of the things in rural India, and that's something all of us should be aware that tobacco in any form can kill you. Mind you, I'm using the word can kill you, not only for the hypertension part, it can cause a lot of other diseases which can induce damages to various organs including stroke, heart attacks, kidney failures. Now finally, how do you monitor this? Obviously, by visiting a doctor to a center, clinic, hospital, you can measure it. But that is not feasible in the busy schedule most of our patients are there. And COVID has taught us the digitalization of healthcare. And that is one of the things I would appreciate is to buy a BP machine, and you can calibrate that regularly once a year and measure, keep a track of your readings. Because if you give me 10 readings, it's easy for me to control or to prescribe medications advice when you have various timings in a given day. Because when you come, we check hardly 2 times, once as soon as you come, then after about 5-10 minutes rest, we tend to check in a clinic setup. But if you have it at home, we always have more number of readings. It's easy for us to titrate or adjust your medications. And I think that's something all of you should adapt. It's about 1,500 a BP machine, very affordable, easy, doable at home. And in fact, now the guidelines have come up, the home blood pressure monitoring readings are different, which are lesser compared to the hospital readings. For example, 140/90 would become 130/80 at home. That is because you are in a controlled environment, within a familiar environment like your home. And that's something which all of us would advise. And stress management. Stress is part and parcel of this era. So there is no question of escaping from your stress based on your profession. You should learn how do you come out of this stress based on your individual capacity through yoga, through meditation, through exercise, through swimming, listening to music. These are the various methods which individually you need to adapt. You need to figure out how to come out of your stress, because as I said, stress is part and parcel of our every career now in this era. There is no doubt about that. And finally, I would urge and request all of you to continue your medications in a regular manner. This is one of the biggest problems we face as doctors, the adherence to medications. When we say twice a day, they start taking, in a week, they take once a day in a week, and then they would tend to, continue. So these irregular medications, irregular timings of medications is a big problem for most of us, because we cannot monitor every patient coming home, or every patient, every wife or husband or brothers, sisters cannot monitor whether you're swallowing tablets regularly or not. That's something very important, to keep the tablets or the treatment on a regular basis. Please do not skip medications. Please do not half. If somebody has written 80 mg, people tend to make it half because they think 80 number is more, 40 is lesser. Please do not do that kind of Indian jugaad in your treatment. And that's something which we tend to request all of you and advise all of you also. Finally, why do we need to control hypertension? Because as I said, hypertension uncontrolled will result in cardiovascular, that is heart attacks, strokes, kidney failures. And remember, just by bringing 10 millimeters of mercury from 140 to 130, your risk for heart attack or stroke reduces by more than 50%. And that's something all of you should remember. Please look at your risk factors, try to find out yourself what is my mistakes, because why I have resulted in this hypertension, and modify the lifestyle, the risk factors which we all while discussed, and adhere to the medications. Visit the doctors in a regular manner as and when the doctor calls for you, and then please be safe, so that we do not want you to succumb to complications of uncontrolled hypertension. Thank you very much.